I yield 3 minutes to the gentleman from Vermont.
Thank you, Mr. Chairman. Boy, do I wish we had more time. Just a few points. Yesterday's Washington Post, the cost of health care. Here's the chart. United States, highest in the world, $2,868. Canada, $1,915. Everybody understands that health care in the United States per capita is far higher than in Canada, despite the fact that they have universal coverage, comprehensive coverage for all of their people. You keep using the word taxes, taxes. Let's not fool the people. In Canada, taxes are a little bit higher. But guess what? They don't have to pay $2,500 per person for private health insurance. That comes out of their tax base. Add taxes, add health insurance together, it's about the same for both countries. Mr. Chairman, 60 years ago, Franklin Delano Roosevelt, as President of the United States, fought for national health care for all people. In 1948, Harry Truman campaigned for national health care for all people. How has it happened that the U.S. today, along with South Africa, remains the only industrialized nation on earth that does not have a national health care system guaranteeing health care to all people? And I'll tell you how it has happened. It has happened not because of a debate over health care. It's a debate over economics. It's a debate over the insurance companies, certain physicians, the pharmaceutical companies, the medical equipment suppliers who are making billions and billions of dollars off of human misery. It's all about Common Causes study, which tells us that the medical industrial PACs have spent $60 million over the last 10 years trying to influence this Congress not to pass a national health care system. It's about the CEO of Bristol Myers Squibb, a large pharmaceutical company who makes $13 million in income in 1991, while elderly people cannot afford the prescription drugs that they need. And the reason we don't have national health care system is that the medical industrial complex is protecting the likes of Mr. Thomas First, the CEO of the Hospital Corporation of America, who last year earned, let me say it slowly, who last year earned $127 million in income running a hospital corporation at the same time millions of Americans can't get into the hospital. That's an outrage. Poll after poll shows widespread support for the Canadian healthcare system among their physicians, among patients, among their political leaders. Poll after poll shows widespread bad feelings, widespread unhappiness with the system that we have here in the United States of America. Mr. Chairman, it is time the American people stood up and said, health care is a right of all people. Let's control health care costs. Let's do what the rest of the industrialized world does. Let us pass a single-payer national health care system. Thank you.